And good afternoon. It is May 4th, 2023. I'm Dr. Deuk Majan here with my team in the operating room, Deuk Spine Institute here in Florida. We're getting ready to start our second surgery for today. This patient travels to us from Ocala, and before Ocala, Florida, he was northern United States, Northwest. So he's here because he's having back pain. The back pain goes into his left leg primarily, but he's also got a big herniation on the right side at L5-S1 that's pinching his right L5 nerve root, which is going to be causing weakness in the right leg and eventually loss of feeling. But most of his symptoms are left-sided, and when you look at his MRI, he's got herniated discs at L3, 4, 4, 5, 5, 1, and L2-3, L2-3, 3, 4, 4, 5 on the left, and really bad 5, 1 on the right. So we're going to be fixing 3 discs on the left side and 1 disc from the right side. All of these surgeries are done transforaminal. We're going to be basically coming in through a hole in the side of the spine called the foramen. Trans means across, so transforaminal. We're going to be entering the hole straight into the herniation. Okay? Let's get started. Why don't we show our audience while we're starting how do disc herniations actually cause back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Now you see why do herniated discs actually cause back pain. It's inflammation. Inflammation in a tear that's located in the back of the disc, called an annular tear. Now, let's look at the x-ray. And Jordan, show us this thing. It's called vacuum space phenomena. Henry, are you able to see it? The white arrow?
Yes, we can.
That's at L5-S1. There's also happening at L4-5, right there. Vacuum space phenomena, folks, is air, not even air, it's space, actually, the lack of air inside the middle of a disc. And it happens when there's a negative pressure, and somehow it manages to get some gas in there by, nobody really knows the exact mechanism. But that gas, of course, is sucked into the disc space because there's so much negative pressure, and that comes from degenerative disc disease. Okay, so we've done the L4-5 access from the left. Now we're going to work on the L3-4 and then the L2-3. So we made a 7mm incision. Now I'm going to head to the next disc shot, and you can see now he bleeds a little bit more than some of our other patients shot, and that's because he's on some type of an anti-inflammatory or something that's thinned his blood. Aspirin, anti-inflammatories, those are very common. That's beautiful. Let's get an AP view and look. I'm going to use the x-ray machine taking pictures of his spine to navigate. And what navigation means is to go from one location to another and to use information along the way. So if you think about the old captains of ships, right? A long time ago, hundreds of years ago, they used the stars to navigate. They also used mountains and islands to navigate. So they used physical structures to guide their voyage. And they were looking for the most direct path. They were also looking to avoid crashing their ship and dying out at sea. But in spine surgery, we use navigational techniques as well. And for spine surgery, we're using the X-ray machine. That's the most reliable tool. But just like just like the captains used, the tool we're using is the X-ray machine. But what did captains use? Anybody know the name? It was a sextant, right? Hello? Am I right? Henry?
I thought you were asking everybody. I truly don't know.
It was like a compass for the stars, but I'm pretty sure it was the sextant. Anyway, look it up. So the captain used a tool called the sextant to navigate. We're using a fluoro. But it's not the fluoro that helps us. It's not the fluoro that we're navigating off of. We're navigating off the spine. So we use actually the spine structure to figure out where to go and how to get there. Okay?
I was about to say Garmin.
Just like a sextant would use, or they would use stars as the points, the physical points, we use the spine as physical points. But we use the fluoro to find them. All right, let's see where that is. I don't know if I can get to the last disc through the same incision. I may have to make a second incision on this side here. Sean? Yeah, I'm going to have to make a second incision. Because his spine, the way the shape is, it's not going to allow me to do all 3 discs with 1 incision. And again, what determines that is the alignment of his spine. It's his natural alignment. Everybody's alignment's different. And in his case, I'm going to have to go into a second spot. Let's get up higher to L2-3. So everyone agree we're doing left 2, 3, 3, 4, 4, 5. We've already accessed 3, 4, and 4, 5. We need 2, 3. And Jordan is helping me trying to line everything up. I think we're off on WAG by just a little bit, Jordan, maybe a degree or 2. So let's see if we can get that pedicle of 3 lined up better. So again, we're going to change there it's better. I think that's better, right? Yeah, that's better. And every little degree matters, folks, when you're navigating. If you're off by a few degrees, it could be really, really bad. Shot? Okay, shot. That feels like the facets, and it is. We need to get around them, and we will. Shot. And this is the 2-3 I'm going for. This is the one that has a really bad left-sided narrowing in the foramen. Very close. Let's get an AP, see where we are. Now notice how much further away I have to make this. That's because of the curvature of his spine. It's not allowing me to do all 3 discs through 1 incision. All right, so we're on track. We're just a little bit too low. Hey, while we were there, let's show the audience something. Show them the dish, which is diffuse idiopathic skeletal hyperostosis. It's going to be on the other side, up at L1-2. Yep, you see that big thing? It looks like corona radiata coming off the sun, a big arc of energy. It's actually a bone spur. And it's part of a condition called diffuse idiopathic skeletal hyperostosis. It's totally benign. We don't do anything about it. We leave it alone. It's not causing any problems or symptoms. Okay. So, I think we're a little too medial. I'm going to start just a tad bit lateral. Shot. That's it? Yes, sir. Shot. Shot. Still need to be a little bit more superior. Shot. Trying to make my way to that L2-3 disc space. I'm just encountering an awful lot of bone along the way. Shot. I think I'm getting around it little by little. By the way, I did see a movie, Renfro, last night, if anybody's considering it. Honestly, I didn't think it was that good. I normally do like Nicolas Cage, but anybody else see Renfro? Huh? No, it's a new one. Shot?
Not yet.
It's a new one. Definitely new.
It's still in theaters.
Yeah, it just wasn't that good.
What does he play, a gangster?
No, he's Dracula.
Oh, Nicolas Cage.
AP? Nicolas Cage plays Dracula. And it wasn't him, of course.
Good review, I like that.
I don't know. I like Nicolas Cage a lot. Lateral. I mean, but some of the movies he's been in lately have been
I
really...
used to see him all the time. He was always at my gym.
Really?
Yeah, every day I saw him.
Where was he in the gym? Vegas or in...
Yeah, he has a place in Vegas.
Oh.
And then he lived across the street from me in Newport Beach.
Favorite Nicolas Cage movie? Gone in 60 Seconds?
I
That,
like that.
that's not a surprise.
Raising Arizona.
I thought Con Air was
Con Air, that was good. Raising Arizona. Dude, Raising Arizona, not many people even know about that movie. That's an oldie.
It's a classic.
National Treasure, that was a good one.
Leaving Las Vegas.
Leaving Las Vegas, right?
Moonstruck.
Wasn't it Fear? Was it Fear? No, it wasn't Fear and Loathing.
No, that was with Johnny Depp.
I actually started that.
You started it?
Yeah, I started it.
Con Air was good. Con Air was good. Wait, what about the one with the island? Wasn't he in, was Face Off with Travolta?
Yeah.
You remember that?
That was, yeah, Face Off was with Travolta and Cage.
What was the one with the prisoners on the island? What was that place? Alcatraz? Wasn't he in that movie?
The Rock.
That,
The Rock.
The Rock.
I was going to say, Alcatraz was a Clint Eastwood.
So many movies. All right. Okay, good. So at this point, you can see that we have to make 2 incisions on the left. We're going to do 1 on the right. All right. So we've accessed 3 out of 4 discs. We've got 1 more to go. Now, how long has this patient had back pain? 40.
4-0.
Oh. And the left leg has been bothering him for how long? Okay, so we'll write that down in a minute. Shot. Jeez. Might be able to come a little bit higher. Shot. Wow. I'm just hitting every piece of bone you can ever imagine over here. Shot. A lot of bone spurs. That's interesting. I wonder if I'm lateral. Let's get an AP. Any questions from our audience so far?
Yes. The question from Darren on Facebook.
Yes, Darren.
They asked, do additional incisions lengthen recovery time?
Yeah. Great question, Darren. Additional incisions do not lengthen recovery time. Not at all. Oh, man. Unbelievable. Huh? I think he has a Bertolotti syndrome on the right. A Bertolotti's. That's incredible. Basically an abnormal transverse process. That is huge. Oh, maybe I got past. Huh? You're okay.
Okay, we're just working on the last one.
Yeah. You're doing great. You're doing great. We're almost
Stay still.
done.
Stay still.
Shot?
We're almost done here. Did really well. Super happy for you.
You're doing great. Just hang in there. You're fine. Shot? Man, I
Years of pain.
yeah. 40 years of pain.
I said
Shot?
40 years, yeah, 40 years of pain.
40 years of pain.
Yeah, you're at 40 years of pain in an hour surgery.
That's exactly what we're going to do. Shot? Are you okay? Let's make sure he's okay because I'm really near his L5 nerve root.
Are you having any pain down your leg? In your back only or down your leg?
How reliable is he?
Back only, he just said.
Back only. Okay, guys. He's had lower back pain. We said 40 years? 40. 40 years, folks. I feel horrible for people like this. Their lives are robbed by back pain. And he's had left leg pain for about 2 years, right? And but he's had the back pain for 40 years. Nobody's ever fixed it for him. It's a shame.
Okay. Yeah, please. Yeah.
All right. Is he reliable?
Yes, we need
Shot?
switch the lights again.
All right. So I'm heading into
Thank you.
the bottom disc. And it is, you can see the needle. Show us that needle. Jordan has done a phenomenal job of lining up the machine. Let's go AP. The X-ray machine, the fluoro machine to the spine. Remember, we just bought these machines. These are top of the line Siemens fluoro machines, best in the world. And they give us really beautiful pictures to navigate with. Looking good. You can see how he's more collapsed on the right side. There's a lot of bone over there. Definitely a Bertolotti's. He has a very abnormal transverse process, so I'm trying to find my way through. Let's hope it works. Feel anything? Anything?
Sir, any pain down your leg?
Where?
Where?
In your back?
Right side on his back, he said.
Yeah, that's where we are. We did it. I don't know how we did it. Got lucky. Better to be lucky than good.
Everywhere on the right side, he said.
All right, relax. We're good. We got everything in where we needed it to. So, folks, if you're watching the surgery, the hardest part of the surgery we've just completed. It's always placing the needles, literally 0.5 millimeter accuracy. There's little holes that I pass through in the back of the spine, not just the neuroforamen, but between bones, transverse process, iliac crest, to get to where I need to be. And I got to say, we got lucky again in getting past some really narrow spots. It's kind of like when you watch those movies with the ships coming in. They got to navigate through the reef, right? If they go a little too much to the right, they're going to hit the coral heads and they're going to punch a hole in their hull and drown. And if they go a little to the left, I mean literally a foot sometimes. What's up? All right. Is he awake? So we do need our patient awake. When I asked him, where do you have back pain? This is what he told me. This area right here. All right. And in this area, he's really got 4 spots that on the MRI look to me like they could be causing his back pain. And then really 3 spots causing left leg pain. So we got the L5-S1 disc, L4-5, L3-4, and L2-3. Are you comfortable?
How are you doing?
Any pain? Are you having any pain?
You gotta speak a little louder for us.
Just say yes or no. He is. Where's his pain?
Where's your pain? Back.
In his back. All right. How bad is that on a scale of 1 to 10? How high did it go?
10.
Is that where you get back pain typically? Is that where you get your back pain?
Yes or no? Is that what you get back?
Sorry, I gotta yell loud to you guys.
You said yes.
But I'm trying to talk to the patient, and he's underneath all these drapes, and he can't really hear me that well. There's some noise in the OR, so I do have to raise my voice. That is the L3-4. He had 10 out of 10 concordant pain. So we just tested one of the discs that we know are, but I believe are causing his back pain, confirmed it, 10 out of 10. That better? How bad is that on a scale of 1 to 10? How high? What's the highest it went, a scale of 1 to 10?
10.
Is that where you get back pain? 10/10. Is that where you get your back pain?
Yes.
All right, so that's concordant. So L4-5 was a 10/10 concordant. Concordant, folks, means it's the same pain patient gets every day. So we've already identified 2 of his pain generators, the L3-4, L4-5. Is it better? Any pain? All right, he's better. Shot? Having trouble there we go. How bad is that on a scale of 1 to 10? How bad is that on a scale of 1 to 10?
What number? Huh? 10. You just
10.
said 10.
Is that where you get back pain every day?
I'm sorry.
Is that where you get your back pain?
Yes or no? Yes.
All right, so look at that. 2-3 was 10 out of 10. 3-4 was 10 out of 10. 4-5 was 10 out of 10. We basically hit the jackpot on where is the pain. All right? Now, that's like getting 3 out of 3 lottery ticket numbers right. But honestly, it's not that hard if you know what you're doing. Kind of knew that the discs were the cause of the pain. Is that better? All right, we're going to put you to sleep in a moment. How bad is that on a scale of 1 to 10? 10. Jordan, show us the x-ray. Hey, Henry, show us the x-ray. Look at the tear in the back of 5-1. Huge tear. Show us the tear, top to bottom. It's the black thing. There it is. It's gigantic. Big tear in the annulus. Herniation. Show us the herniation, the black stuff. That's the herniation, folks. All right. When he wakes up, his leg pain should be gone. His back pain will be gone. He's going to be a happy camper. I just checked on the last surgery patient who we did earlier. He's already leaving, and his pain is basically gone. He's very happy. All right, we'll start here at, I guess, L4-5. Any questions?
No current questions, but we do have a comment from Canes25 on YouTube.
Oh, my friend. Yep.
And he says, Cage is the best when he plays psycho crazy roles with those eyes.
Yeah, right? Yeah, you're right. You're right. He did another one. One of my favorites is Bangkok. What's it called? Bangkok something. Bangkok Dangerous, maybe. All right, Num Num.
I'm looking it up.
I think it's Bangkok Dangerous. I love that movie. That's a really good Cage movie, and he does go crazy in that movie.
You are right. Bangkok Dangerous.
If you haven't seen Bangkok Dangerous with Nicolas Cage, check it out. And he also did Lord of War, didn't he?
Yes. Wow, I forgot about that movie.
That's a good one.
It's amazing.
Really good one. Yeah, Cage is amazing. But some of his later movies have just been garbage. And I've seen some weird ones.
I like them, the one with Morgan Freeman. I can't remember.
Yeah, he did one with Morgan Freeman, right? That was like a drama? A drama? Wasn't it a drama he did with Freeman?
I think so. Let me check.
He did one that's called The Color of Space. That is recent, a couple of years ago. It was just so bad. Holy God. You know when you have like a Apple movie account and you buy these movies and then some of them are so bad you're like, I wish I could delete them, and you can't. Apple doesn't let you delete movies. I mean, if somebody knows how to delete movies from Apple, let me know, because there's a couple I want to get rid of. Yeah, they're so bad. Oh, did you hear that suction? That was pretty cool. A little vacuum space thing going. Not the color of space, but the vacuum of space. So here we are again, kind of doing the same thing. For those of you who have come here many times to watch, you see we do the same surgery over and over again because it works. I could literally take 100 million people with chronic back pain in the world, put them on this operating table, and do exactly the same surgery. Now, of course, depending on the side of the disc and the disc levels, that would change, but I would do the same exact treatment and all their pain would go away. We could cure everyone's back pain with this treatment, or the Deuk plasma rhizotomy. Looks like we got a little cold welding going on. Oh, that's better. All right, we're in. Let's get the dilator out. The reason is because we have discovered the source of back pain. And we're targeting it with the laser to clean it up and get rid of it. And that's what we're going to do for this gentleman. We do probably 3 backs to every cervical, maybe even 4 backs to every cervical. So we have a lot more lumbar patient surgeries than we do cervical. I don't think cervical disc symptoms are quite as common as lumbar. So that's why we do a lot of lower back. And then of course thoracic is the least common, but there are a lot of people with thoracic pain coming from a bad disc. All right, heading in with the endoscope. Remember, we're going to do 4 discs. 3 of them are on the left, and 1 of them is on the right. By the way, again, this is the second surgery today that's a 4-level disc. Okay? We did a 4-level on Tuesday, but we didn't do Deuk laser disc repair. We did a fusion. For those of you who were able to watch that surgery, if you weren't, you're welcome to watch it on YouTube. Just look back a few days on our YouTube channel and you'll see the lumbar fusion. It's a 4-hour surgery, so I'll warn you, it's a long one. And that would be the alternative treatment to what we're doing right here. I don't know anybody who really wants that. Surgery done instead of this. This is a much better option in my opinion. But like I said the other day, that patient chose a fusion for reasons unknown to me. But my philosophy is don't force patients to do what you want them to do. Give them choices, give them information, let them choose for themselves. So that's what we do. We're not their mommies or daddies. You know, the patients we treat are mostly adults, so they can make up their own mind. And one thing I've learned over the years is everybody thinks differently. There's not one way of people to think. Just like people think differently about Nicolas Cage and his movies. Some people like certain movies, other people don't. All right, I'm going to pull back a little bit. And you can see the tear right there in the annulus. And that's where his back pain's coming from. A little bit of inflammation there on that piece of white annulus. You can see the pink color, right? You guys all see that?
Yes, we do.
Pink, blue, and white. That's mostly what we see here. A little bit of orange when we hit some calcium deposits, some bone spurs, basically dystrophic calcification. But there's your tear. Look at that inflammatory tissue. You guys see it right there, huh? Henry, you got pretty good at seeing it.
Yes, we do.
It's in every single patient with back pain from a disc. You're going to have that pink stuff. It's just a matter of whether we see it clearly or not. Okay, let's run the video on how does the Deuk laser disc repair actually eliminate people's back pain. How does it work? We may have already ran it, but let's run it again.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, Submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. And hopefully you are a little more knowledgeable about how the Deuk laser disc repair procedure works. Right now I'm using the laser to debride this tear within the annulus, and I'm looking 360 all the way around. I want to not miss anything. I'm checking everything out, making sure I get all the loose stuff out. There's your tear. There's some more pink stuff right there. You guys see the granulation tissue again? Right? Pretty cool. Anyway, that's the cause of the back pain right there. And it's tiny. Oh, to give you an idea, the width of the glass fiber is 1 millimeter. So that is a 1 millimeter spot, and yet so painful. So painful. All right, let's take some questions and we'll do some answers.
First question is from Darren once more on Facebook, and they asked, what was bad about Renfield?
Oh, what did I not like about Renfield?
Correct.
So a few things. I mean, of course, I like the main characters, both of them, and the female. She was all right. The Asian police officer is a little annoying, but I don't know. It was kind of a weird storyline, and you know, the bad guys were so predictable. There was really nothing there. It was just kind of silly mobsters, silly bad people. They didn't really add anything to the story, in my opinion. I mean, the special effects were hilarious. My gosh, look at all that inflammatory tissue. I'm feeling like we should get a picture of that. Take a picture and let's add it to his video testimonial for tomorrow when he does it. The special effects were kind of amusing. There's the pink stuff right there. You see that?
Yes, we do.
That's the granulation. So like the arms are getting ripped off, people's bodies are getting chopped in half. There was blood everywhere. It was just kind of silly and fun, but I don't know. It was just a little bit too silly and fun. You know. I just didn't really care that much for it. Really, a lot of the movie, I just felt like I'd seen this 1,000 times before. You know what I mean? There were some parts that were pretty cool, but most of it I didn't care much for. Very violent, very violent. If you watched the vampire movie, the spoof, I think What We Do in the Shadows was the name of it years ago. That thing was hilarious, right? Very, very funny. Not really gory, not really violent, just funny. And that's kind of what I was hoping Renfield would be, but it wasn't. So anyway, I don't mean to ruin it for anybody, but make up your own minds. I don't think there was anything wrong with Nicolas Cage's acting. He did a great job as always, but I just feel like it was more the storyline that was the problem. Some of the other characters, so cliche. So anyway, I'm not a movie reviewer. I'm not going to pretend to be Siskel and Ebert, but I just didn't care much for it. I wouldn't watch it again. I actually bought it, paid for it like 25 bucks, watched it with my son, and I would definitely not buy it again. Almost done with this disc. I also watched Dungeons and Dragons with Chris Pine. I thought that was pretty good. A little bit better than the Renfield. All right, what other questions do we have?
Next question comes from Darren once more on Facebook, asking, how many surgeries do you do a year?
How many surgeries do I do a year? It's a great question. So the typical neurosurgeon would probably do around 300 to 400 a year. I probably do less. I might do 200 to 300. Maybe the reason is because I'm a little bit further along in my career and I'm not as aggressive at pursuing surgeries as some of the other surgeons might be. to be honest, I really don't have any debt. So I don't look at patients like I got to do surgery, or I might not be able to make my monthly payments. I know a lot of surgeons think that way. Unfortunately, a lot of them won't retire. I hear a lot of surgeons won't retire because they can't afford to retire. So if you got a surgeon who's really old and they can't afford to retire, that's a problem. That means you're keeping them, out of retirement. Basically, you're supplying them with whatever they need. Like, they can't afford to retire means they got bills to pay, right? And you don't want to be that patient seeing a surgeon because they've got bills to pay. That's just, I don't think, a good thing. So if anything, you want to see a surgeon who loves what they do and they're confident in their ability to fix you in a very safe and effective way. Safe and effective. Okay? That's the key word, safe and effective. Safe means low complication rate, fast recovery. Effective means it works. And that's what the Deuk laser disc repair is, safe and effective. So I just love doing what I do. Could I do more surgeries? Sure, I could. I probably am at 50% capacity of what I would at most want to do. But that said, I have other doctors who could pick up the slack if there was any. So you got to understand something. You're watching a live stream from an operating room of a small practice that's literally contained in one building with just a few doctors. You're not looking at the Mayo Clinic or Harvard, even though they should be the ones broadcasting because they have the resources. They do far more surgeries than us. But we do this because we can do it, and we want people to see what we do because we believe in what we do. We believe in our technology so much, we want people to see it. Seeing is believing. Anybody ever grow up with that? Seeing is believing? Of course, that's really not true anymore with the deep fakes that are coming out. You got to be careful because seeing is not really believing anymore. But until 2020s, with all these deep fakes, seeing is believing. And that's how we grew up in my time, is if you saw it yourself, it could be believable. That's why nobody ever believed in Bigfoot or aliens, because nobody really saw them. We heard about it, but we never saw it. And unless you see it happening, you really can't believe it. Well, what you're watching here today and what we've been broadcasting for 10 years out of Deuk Spine Institute is real. We're not editing these. And that's one of the reasons we do a live stream, is so people can see we're not editing anything. We don't take anything out of these surgeries. We want you to see everything. If we have trouble, we want you to see the trouble we're having, how we get out of it. It's important that doctors learn how to get out of trouble. So if I figured out a way to get out of trouble in surgery, I want to share that with other doctors. So how best to do that then to record it and broadcast it, so that people can learn by watching it 50 years from now, 100 years from now. They can go back and watch my surgeries long after I'm gone, and they can say, oh, that's what Dr. Deuk did. I see. Okay, that's what we need to do. All right? So I want my work to be remembered after I'm gone. I want people to benefit from my surgeries long after I'm gone. The only way that's going to happen is if other doctors learn these techniques. And the only way that's going to happen is if patients demand it. If patients demand less invasive, better surgery, then their doctors will have to provide it. They'll have to respond. Okay? But you guys have to drive that demand. I can't do it. They don't care what I think. They're going to keep doing invasive surgeries until you guys stop them. You guys are the patients, of course. All right, just about done here. Well, we got a few more to go, so don't get too excited. But that's all the herniation at this level. You can see the clean tear right there. Watch enough of these, you see what I'm talking about. Any other questions?
Yes. Next question comes from Canes25 on YouTube. And they asked, If I'm not mistaken, did you say you did surgery on your mom? If so, how's your mom doing?
Yeah, I did say that, didn't I? You caught that. Somebody's paying attention. Well, after the fusion 2 days ago, I did surgery on my mom. My mom is a frequent flyer here at Deuk Spine. What I mean by that is I've done her carpal tunnel, I've done her neck, and then she's got back pain, so I did a Deuk plasma rhizotomy on her back for back pain, and it's 100% gone, her pain. So she's very happy. And she has no more back pain. So, yes, I did. Actually, I've done surgery on a lot of my family members over the years because they don't trust anyone else but me. They come to me. My brother's also a neurosurgeon, but she didn't go to him. Too bad, Armin. I mean, I honestly don't know if that's good or bad because I don't get paid for my work on her. So maybe my brother's laughing at me right now, right? Since I'm the one actually who's paying for her surgery. But yes, I did a Deuk plasma rhizotomy for facet pain. It's 100% gone. She's rubbing it in my face a little bit because I thought she had some disc pain as well. And she's telling me she has zero pain. I didn't fix her disc. So on the other hand, if she does get pain in that area again, it's going to be the disc, and we're going to do the Deuk laser disc repair. But she was convinced it was her facets, and so far she looks like she's right. Hey, patients know their body the best, right? Okie dokie. Yeah, she's 80 years old, by the way, in case you're wondering.
The whole world should have moms as nice and classy in here.
Oh, thank you. You're very sweet.
That's a pleasure to work with.
Yeah, she said all the nurses here are the best.
She said that?
Oh, yeah. She said everybody here. She said all your people working there are literally the best. And she's been coming here for years, so she knows everybody. All right, we need injection. Num num. That reminds me, she left me some food in the refrigerator. Don't let me forget. All right, guys, remind me. She left me some basturma. Anybody know what basturma is? It's an Armenian meat. It's cured like meat, steak, basically, surrounded by cumin, a preservative, cumin, and it's a red paste. My grandfather used to make it in Egypt, and he was famous in all of Egypt for making basturma and sujuk. Anyway, it's delicious. It's very lean. There's no fat on it. It's cured. So it's not cooked, but it's raw, but it's been cured, and it literally sits and ages for months, you know, hanging in a dry area. And my grandfather used to make it all the time. We used to eat it as kids. He had a delicatessen in Los Angeles. Take it out.
Your grandfather did.
My grandfather. My grandfather was a champion wrestler of Africa, Greco-Roman wrestling, all of Africa, the entire continent, back in like 1915, 18. And then he retired when he was like 18 years old because he had, in Greco-Roman wrestling, they try to break your hands and break your arms like your opponent does. So he had knuckles that were like as big as my kneecap. It's just arthritis, horrible arthritis from all the fighting he did, the grappling. Anyway, he was a champion, didn't make much money, but he became famous. So then he opened a meat factory in Alexandria, Egypt. People came from all over Egypt to eat his meats. And that's what he finished his career doing, is meat.
And he moved it from Egypt to LA.
Moved from Egypt, Alexandria to New York. Through New York to LA eventually. Yeah. That was in 67, 68. Because Nasser came into power in Egypt, and he was trying to, take all the Christian They're trying to basically discriminate against Christians and persecute them. And Armenians are Christians, so they would just go and steal their land, steal their, you know.
So it wasn't a good, safe place for him to be.
No, it wasn't safe. So they had to get out of there and escape. I think they escaped through Lebanon, and eventually they came to New York and then Los Angeles, and that's how I ended up in California. Well, I was born in Germany on a U.S. base, military base, and then eventually grew up in California. But yeah. My mom, on the other hand, her family's from New York, and originally Amsterdam. So, all right, what other questions do we have, Henry?
Next question comes from Darren, once more on Facebook, asking, do you have a patent on DLDR?
Do I have a patent on DLDR? I do not have a patent on DLDR. I do have a patent on the name, Deuk laser disc repair. I have a patent pending on the Deuk plasma rhizotomy. But you're right. Anyone that knows what they're doing could do what I'm doing. And I think there are doctors starting to do it around the world. Don't ask me where. But to be honest with you, the capital investment is massive to do what we're doing. There's a lot of money that has to be spent. And there's not a lot of countries that can afford to buy all this equipment. So, sure, there's endoscopic surgery being done elsewhere, but the laser itself is over $100,000 machine. And, you know, the problem with healthcare is that when you get in a situation where a doctor doesn't have the money, a lot of times that won't stop them from trying, which is good. But many of them will end up buying inferior equipment or inferior medications. And those inferior equipment and medications don't produce the same results. You have to have exactly the right equipment, exactly the right medication, exactly the right supplies. And anytime you deviate from that, for whatever reason, availability, finances, then you're going to have potentially different results, right? If you're making pancakes and you use milk, and your pancakes are wonderful, and you run out of milk, maybe you can use water or soy, but I guarantee you those pancakes aren't going to be the same. So, you know, people, unfortunately, and even in healthcare, that's a disc herniation, by the way, they'll cut corners because they don't have access to certain things, and it changes the outcome. But that's also how good things happen too, right? Better results could potentially come about as a result of those kind of changes. So I'm not saying don't do it. I'm saying think about what you're changing and make sure that it's not going to compromise the quality of the outcome, that it's going to not going to make it worse for the patient, right? Because you don't want to have a bad outcome for the patient. Patient trusts you. They want you to make decisions for them that are in their best interest. And if you're cutting corners for financial reasons and they suffer as a result of that with a bad outcome of surgery, then you failed your duty as a doctor to the patient. And that's not acceptable under any circumstance. The reason I personally don't provide certain services to patients because I'm not capable of providing them the very best care. For example, if you had a brain tumor and you came to me, I would say, I'm not comfortable doing that brain tumor. I'm going to send you to somebody who is. And that, what I'm really saying is I'm not the best person for you to do your brain tumor surgery, even though I'm a neurosurgeon. I'm perfectly capable, trained, I know all the steps, I know it needs to be done, but I don't remember the nuances, and I don't have available the best equipment right now for brain surgery. Okay, I have the best equipment for spine surgery, but not brain surgery. So if it was me, I wouldn't want my surgeon to do surgery on me if they couldn't provide the best care, right? So I think doctors owe it to their patients to be honest about that. And if they're not able to provide the very best care for something, they should offer to refer the patient elsewhere. Of course, emergency is different. If somebody's dying and you're the only one available, and you have to provide that service to the patient. Great questions.
Next question comes from Darren, once more on Facebook. And he asks, does nutrition play a role in spine pathology?
Does nutrition play a role in spine pathology? Great question. I would have to say today, I don't believe it does. Of course, I don't know exactly what you're asking, but if you're saying, if you're fat, do you have more spine pathology? The answer is no. If you're asking, if I take this supplement, will I not have spine pathology? The answer is no. There are no supplements I'm aware of that eliminate or prevent spine pathology that would need surgery. Huh?
Back in the old days, they always said that smoking caused desiccation, triggering annular tears.
Yeah.
I don't think that's true. I think it's been disproven, right?
Yeah. So Dr. Berndes is saying they used to have a lot of rumors about spine and nutrition. For example, smoking or obesity, but those are all rumors, okay? The smoking thing is literally just an excuse for the insurance companies not to pay for your spine surgery. Okay, they realize that a lot of people smoke, and that if they make it a requirement for you to quit smoking before you get back surgery, that a lot of people won't be able to quit because they're addicted. So then they won't have to pay for back surgery. But the reality is when I look at my patients that smoked versus didn't smoke, they all did the same. So smoking did not have a bad outcome on my patients' outcomes, okay? So I think the whole smoking thing is just a scam for the insurance companies to try to get out of paying for spine surgery. Or if you have a doctor who doesn't want to do spine surgery on you, they'll use that as an excuse not to do spine surgery. But you know, the real truth is I haven't seen smoking negatively impact patient care with Deuk Spine Institute's procedures. And we do all kinds of spine surgeries here. So, sure, the anesthesiologist doesn't want you to be smoking, and gosh, if you're smoking, don't quit like the day before or 2 days before. You need to quit a week before, because otherwise you start to get all these secretions in your airway, and they can obstruct your airway and cause problems ventilating. So if you're a smoker, just keep smoking. You know, it's terrible to say it, but right, that's the God's honest truth.
What about incisional infection?
Incisional infection, I don't think smoking has anything to do with it. I mean, sure, in theory, right, smoking is the nicotine is supposed to decrease blood flow through arterioles, so you get less blood flow. And I always tell people to quit, but I would never withhold surgery on a patient because they smoke. I don't think the smoking plays that big of a role in their recovery.
Carrying capacity, so your carbon monoxide level is elevated versus your
Sure.
O2 levels.
Yeah, okay. So Dr. Berndes is saying, you know, what about oxygen carrying capacity? I mean, I'm not arguing you, Dr. Berndes. It'd be better if the patient didn't smoke, no doubt about it. I'm not arguing that. I agree. If I had to choose, patient without smoking, definitely. But I'm not going to deny a patient surgery because I think the outcomes are very, very much the same. I don't think there's a significant difference in outcomes or complication rates between smokers and non-smokers.
I would rather do anesthesia on a smoker than a marijuana smoker.
And Dr. Berndes says if you're going to smoke, don't smoke marijuana. That marijuana stuff, and probably vaping too, right? It screws up. So if you're going to smoke, vape is the worst, marijuana is the second worst from an anesthesia standpoint. Okay, what he's talking about is vapors have the biggest problems during these surgeries with their lungs.
Causes restrictive lung disease.
Causes restrictive lung disease. Not good if you're having anesthesia for your spine surgery. So the worst is vaping, the second worst is marijuana smoking, and the third is just regular nicotine tobacco smoke. But at Deuk Spine, we don't turn people away for any reason like that. We operate on people who've had COVID, who don't have COVID, who've had the vaccine, who've not had the vaccine, who smoke, who don't smoke, who do drugs, who don't do drugs. Obviously,
Plays less of a role because they're not having to get treatment.
yeah.
It's less of a.
We're going to optimize the patient. We're going to make sure they're not on cocaine the day before their surgery.
They would get cancer.
Right, they get canceled. But we're not going to deny people treatment that could save their life or improve their life just because they're doing things we don't agree with them doing, okay? We're not here to judge them. We're not like those doctors that are so judgmental just because it makes the doctor feel better. We realize everybody's human. We all have weaknesses. No one's perfect. We work with your imperfections and try to help you get better. All right, that's it. It's kind of nice having something to talk about because then I don't have to think about this surgery. All right, I'm going to get a little bit more of that annular tear right there, and then we're done. At this level, we got 2 more to go. Tell me about the last surgery, guys and gals.
Thoracic TA.
Thoracic.
Single level.
Single level thoracic. Wow. Pretty cool.
From Brazil.
From Brazil. Oh, yeah. Oh, yeah. So the next surgery is going to be a thoracic DLDR. 1 level. Patients from Brazil. Somebody was asking earlier about whether we take patients from Mexico. We do. We take patients from all over the world. They come here because they want to get better. I'm going to try to grab and see if I can get any herniation, but I think we're just about done here. Can see the epidural space, and it looks pretty darn good. I don't see any more herniation there. And this was the side that he had his worst pain, his left side. I just got a little vein there, no big deal. I don't see anything significant, so we're done.
Lights on.
Any more questions, Henry?
No current questions, but we do have a comment from Darren, once more on Facebook, saying a surgeon in SoCal claims to do the same surgery, but I noticed he had a lot more blood loss than your surgeries.
Yeah, I'm not sure what the surgeon in Southern California claims. I could probably tell you who it is. Dr. John Chu? Or if it's not Dr. John Chu, it's going to be, give me a second, let me just think. Forgot his name. I know him though. The one I'm thinking about bounces around quite a bit. But I have a feeling it's Dr. John Chu. If it's not John Chu, what is his name? All right, tell me his name. Here's some herniation, by the way.
So far, someone said Mork?
Mork, yeah, Tony Mork. I know Dr. Mork. He does not do the same surgery I do. So John Chu, Tony Mork, they are endoscopic surgeons, absolutely. They do endoscopic spine surgery, but they don't do the Deuk laser disc repair. And if they do, well, then, hey, you know, there you go. They recognize a good thing, and what do they say? When people copy you, it's a sign of flattery. It's a compliment. What's the saying, Berndes? Imitation is a sincerest form of flattery. There we go. So I know Dr. Chu, I know Dr. Tony Mork. They do endoscopic, but they don't do what we do here. And the results are not going to be the same. So I would personally would not go to them for a lot of reasons. I don't want to get into it, but I don't even know if Dr. Chu is still practicing. I heard he got into a lot of trouble with some very bad results. I can't say specifically because I don't know how much of it's public. And of course, Dr. Tony Mork, I've known him for years. And you know, I'm entitled to my opinion, but Dr. Mork should have retired a long time ago. Don't mean to be mean or callous, but I'm just being honest with you. All right. Gosh, I remember thinking probably 10 or 15 years ago, I'm sorry, but this is my broadcast, so I get to be a little bit mean. I remember when I was talking to Mork like 15 years ago in Phoenix at one of our meetings, I remember thinking, when are you retiring? Why are you still practicing? My God. Right? That just gives you an idea of how old he is and how long he's been around. But good guy. Got nothing bad to say about him. But he does not do the Deuk laser disc repair. I can promise you that. I know exactly what he does. Okay, 5, 4, 3, 2. But he does do endoscopic spine surgery. And honestly, I don't know where he is right now. He's moved around the country so much in the time that I've known Tony Mork. He's been on the East Coast. He's been on the West Coast. He moves back and forth. I don't know why he moves so much, but I'm sure he's got his reasons. I actually stay here in Florida. I've been here for 20 years now. If you want to find me, you know where to find me. I'm right here.
Darren said yes, it's Dr. Chu.
Dr. Chu, yeah, John Chu. Yeah, Darren, I don't think Dr. Chu is practicing anymore. I think they took his license away, but I don't want to say anything other than that, okay? They also took Dr. Bonatti's license away a month ago over here in Florida, spine surgeon. The Board of Medicine came and took his license away for doing bad things. So a lot of spine companies come and go. What I find is the ones who provide great care for the patients typically stay, and the ones who are doing some bad, questionable things typically go. I think Dr. Chu was a pioneer in his time. I don't know if you've ever seen him or met him, but he's one of those that honestly retirement wouldn't be such a bad thing. You know, he's much older than I am, and I'm not saying because of his age or anything, but maybe his performance has decreased as a result. I don't know, of some medical issues, but I do know that I think he's out of business. So, as a matter of fact, John Chu was practicing in Thousand Oaks, California, which is my hometown. I came from Thousand Oaks. I grew up there in the 80s. Beautiful, beautiful place. I miss it terribly. The Oaks Mall. I grew up over there in Lynn Ranch, just minutes from the hospital. My dad was on staff at the hospital, Thousand Oaks Hospital, and Simi Valley and Westlake. 3 hospitals my dad worked at. He delivered babies back in the 70s and 80s. Then I ended up going to UC San Diego, so I moved to San Diego for college, and then Los Angeles for med school, and then Florida for neurosurgery training. Dr. Chu has been in Thousand Oaks for many, many years, and I've seen him at meetings, and honestly, I admire the fact that he wants to improve spine surgery. Any spine surgeon that puts patients' needs ahead of theirs is a good doctor, in my opinion. It's just, unfortunately, it's not easy to navigate all the regulatory issues in healthcare. Not easy for anybody. We're always all looking over our shoulders, wondering what's coming from the government. What are they going to do next to make it harder for us to take care of patients, right? I think the government's starting to realize they need to play more of a supportive role to doctors rather than an adversarial role. The people that are harming patients the most today are insurance companies. Declining reimbursements in both ways. Declining and declining. Okay, any other questions?
No current questions, but we do have a comment from Brian on YouTube.
Before you say that, by the way, if you're noticing, I'm going in with the metal grabbers and I'm grabbing out little chunks, right? Those are all pieces of herniation. Those were in the foramen, causing foraminal stenosis, and now I've used my dilator and I've shoved it through the herniation, pushing it back into the disc. So I'm inside the disc right now, taking those pieces out. And the person who taught me this was Dr. Anthony Young, one of my mentors, who taught me lumbar endoscopic spine surgery, taught me a lot. And he knew Dr. Chu quite well. He introduced me to Dr. John Chu years ago at a meeting. So all right, go ahead. From Brian.
From Brian, they said Mork was licensed in Florida, I believe.
Yeah, like I said, Dr. Mork literally jumped around to the West Coast, East Coast. He's moved around quite a bit. I don't know why. I couldn't really answer that for you. I never got a straight answer from him. But he's definitely moved around, which is not necessarily a bad thing. It's just not typical for surgeons to jump around different locations, but it does happen. You know, family circumstances, personal circumstances, whatever. Yeah, I don't think he had offices on both coasts. I think he actually switched businesses, practices. There may have been other reasons. But I would just be speculating. I do have some fond memories with Dr. Mork and some of the meetings we went to together years ago on endoscopic spine surgery. We ran in the same circles. I was a very younger surgeon. He was past his mid-career, I would say, but still very inquisitive, wanting to learn more, learning how to do it better. He was spent a lot of time with Dr. Anthony Young as a mentor. I think he's an orthopedic surgeon, if I remember correctly. Mork is, I think he's an orthopedic. John Chu is I can't remember what John was, but I think Mork was an orthopedic. It's been a long time. Seriously, years, at least 10 years, 12 years since I saw him, interacted with him. Yeah, thanks. All right, we are once again at the apex of the herniation. That's the farthest back part, and we're just cleaning up this tear, the annular tear, getting rid of the interposed nuclear material. Some scar tissue right here, the white stuff. The orange stuff is calcium, and the gray thing in the sides is my tube. You can see the little scratches on the side of the tube. The clear thing is the laser fiber. It's glass. It transmits laser energy through the center of it to the end, where the tip of it is where the laser energy comes out and it breaks up tissue. I've talked about this before. I might as well talk about it again. The way laser energy causes its therapeutic medical effect is it basically is high frequency, high energy, absorbed by molecules, mostly proteins, that once they absorb that energy, they literally shake and vibrate so hard that they break apart. So it's kind of like the old days, Red Rover, send Johnny over, and you would be sitting there on a line holding hands with the other kids, and somebody would come over and literally, smash right through your bond, which is your hand holding. So The laser energy basically does that. It comes out and smashes right through those bonds holding the amino acids together, the primary protein structure together, and it basically breaks proteins up into lots of little pieces. And then, of course, those pieces are somewhat microscopic. If you look at the water around the glass probe, you can't really see it that clearly. That's because of all the little pieces of disc material floating around in the water column. If I stop, you can see the water moving. You can see a little more clearly too. But once I start again, it becomes hazy because there's so much material in that column of water that's floating out of the patient, getting rid of it. But that's what makes it hazy, is all the herniated discs leaving this area, going out. If you look at the blue towel that I'm working next to right here on the surface of the patient, we'll look at it later, but you'll see lots and lots of little pieces of herniated disc in it. Okay? They all floated out. That's usually when I do my Pennywise imitation. They all float. This is a piece of herniated disc too. The blue stuff is degenerated disc. It stains blue because it is acidic, A-C-I-D-I-C, acidic, pH less than 7.4. And the reason it's acidic, it's not normal for it to be acidic. It's that way because of the effect of inflammation for years, changing its chemical composition and making it more acidic. Therefore, by the time we get here and put some blue dye in it, the blue dye binds to all the acidic side chains, proteoglycans. Okay, just about done. We're at the back of the disc, totally at the back. We'll finish up here and then we'll move on. This is one of the worst stenosis areas. This is, I think, probably the most important for him, and I want to make sure I do a really good job because I don't want him having to come back again. I want to get it right the first time. So we're going to clean all this herniation up, every little bit of it that I can get to. Questions?
Question from, well, these next two are comments. This comes from Mario on YouTube.
Mario, great movie, by the way.
Love that movie. And they said, Ventura County, I'm from Oxnard, Dr. Deuk.
Oh, nice, Mario. Very nice. Yeah, Oxnard, just a little north of Ventura County. Yep, that's where I'm from, BC. Oh, you see that herniation come out? Oxnard, beautiful, right? Santa Barbara up there. We used to go up to Oxnard to get our Christmas tree every year. When I was living in Camarillo, I used to live on the outskirts. I used to live in Thousand Oaks, and then we moved from kind of by the Oaks Mall, you know, by Lynn Ranch area. We moved in 1980 to Camarillo, to the hills, right outside of Thousand Oaks. You have to take the 23 north. I think the exit was Lynn Road, and then I would take those roads over there and get up to my house. We used to have a beautiful view of Oxnard from our hill off of Priscilla Road. Prescilla, like Priscilla Presley. So we used to live at the top of the hill there overlooking the entire Oxnard Valley and out to the ocean by Santa Barbara. I grew up there. As a matter of fact, we used to have some pretty good parties. One time we had Morris Day and the Time came to one of my parties. We had some raging parties out there in the middle of nowhere in the hills. It's pretty incredible back in the 80s. Oh, look at all the herniation coming. So we're not quite done. We're very close. But yeah, good times. Good times. Thousand Oaks, Oxnard, Camarillo. I almost ended up in Santa Barbara, at UC Santa Barbara, but I wanted to go to a better school. At the time, San Diego was better, back in the 80s, you know? So I chose UC San Diego. It was, to me, it was the best UC school out there. I didn't want to go to LA because LA was in the smog and traffic and all that nonsense. So I chose San Diego, beautiful La Jolla. Great choice, very happy, great education. I don't know how it is anymore, but I don't know if the school is still as good. My daughter's interested. My niece just got accepted to UC San Diego, and she's choosing to go to University of Florida in Gainesville instead of UC San Diego. You have no idea how I feel about that. I would never choose UF over UC San Diego myself, but I guess my sister wants to keep her close by, you know? Plus she has a boyfriend, I guess, but you know, sometimes people make not such good choices. I would definitely go to San Diego. How about you, Luis? Luis would go to San Diego. Huh? You would choose San Diego, UC San Diego, right? Luis is like starting to doze off, right? Luis would love San Diego. Oh my, it's not party, it's just so beautiful. Clean, healthy, the beaches, oh my God, the sun, the weather, it's so perfect. The problem is San Diego has too many neurosurgeons. When I was looking, what am I going to do when I graduate? I was looking at San Diego, they have one neurosurgeon for 20,000. You're supposed to have one neurosurgeon per 100,000. And they had 5 times too many neurosurgeons. And the neurosurgeons that I knew that were working in San Diego, they were living in apartments and they were very poor. I'm like, I don't want to live in an apartment. So my wife said, let's just live here. Let's have my parents take care of our babies so we can work. That's what we did. All right, what other questions you got, Hen?
Next one comes from Darren once more on Facebook. They said, just before I was to start medical school at Texas Tech, my mentor convinced me not to because insurance was going to control my practice in the future.
Well, your mentor is right. I'm sorry, Darren. Your mentor is right. Insurance companies are trying to control healthcare. I mean, look, I'm sorry. They are controlling healthcare, not trying. They are controlling healthcare. And you know what, Darren? The decision is this for you. Do I want to do what I love and want to do, or do I want to let someone else tell me no, right? And I honestly looked at healthcare the same way, like this is bad. You know, we can't even practice medicine anymore. It's not between the doctor and the patient, it's all about what the insurance company wants. But I found a way around it, and I'm doing it right now. So yes, you're right, the vast majority of the people are going to be stuck doing whatever the insurance company wants, but there is a way to maybe make it better. Let me see the laser. There's a little bit of herniation just underneath the nerve right here. So I get it, Darren, you're right. It's scary, very scary times, to be honest. I don't know what the future holds, but I'll tell you what I'm going to do. I'm fighting the insurance companies. I'm not just going to go along with what they want, especially because what they want is bad for patients. You know, when I became a doctor, I made a commitment to do what's best for the patients. And even if that means fighting the insurance companies. So that's what God's plan is for me. That's what I'm going to do. Okay, all done here. One more to go. This has been 2 long cases, 4 levels each, very long. But I hope you do find something you enjoy, Darren. Maybe you can consider physician assistant. I don't know if you've thought of it. I don't know what you're doing in your life right now, but a PA is a good way to go. It's a lot less years, less time, but you get to do, like, you know, come work at Deuk Spine and can assist me in surgery when we get busier. Physician assistant's not a bad job. Oh, by the way, can you see this here, Henry? Remember we were talking about how the laser breaks up the disc into lots of pieces?
Yep.
You see all these little tiny little pieces of herniation everywhere, right?
Yes, we do.
That's from the laser breaking it up. Okay, one more to go on the other side. I'm going to switch sides. So far, great questions. I appreciate you guys asking me questions, by the way, because it helps me take my mind off my back, which is getting tired of standing here. And I enjoy teaching. I've been teaching ever since high school. I love teaching people. And after all, that's how I learned. I got taught. So I'm very grateful to my teachers who helped me become what I am today. I wouldn't be here without my teachers. So teachers are very important to me. And I think it's important that people pass on their knowledge to others so those that are interested in learning at least can become better at what they do, you know? So I wish you luck, whatever you have decided, Darren, in your life. And if you do decide to stay in healthcare, come to Deuk Spine. We love people who are passionate about healthcare. All right, we're going to go to the right side, L5-S1. You can see the dilators going down, num-num. Probably another 10, 15 minutes, hopefully. I'll take more questions if you guys have them.
Next question comes from April on Facebook.
Hello, April. Welcome to our broadcast.
They asked, do you have any experience with PEMF for this type of injury, and do you ever recommend it for the healing process?
PENF. I must say, I'm not that familiar with that acronym. PENF. Do you know what that is, Shot?
PEMF.
PENF. PENF. I don't know what it means. Shot? I'll be honest, I don't know what that PENF means. Maybe you can tell us? I probably know what it is once you explain it to me, but Shot? But I'm not really sure what exactly you're talking about.
I think it's pulse electromagnetic field therapy.
Ah. Okay. Okay. Well, you may not like my answer on that one. I don't believe in that technology, but I could be wrong. Could be a good technology.
Yep, that's what she said. Pulse electromagnetic frequency therapy.
Yeah, I'm not a big believer in that. I don't think that works. But like I said, I don't know everything. I'll be the first to admit it. Shot? There are lots of things in healthcare I don't know enough about, and I have to admit that's probably one of them. It could be that it works, but I have never seen any evidence that it does. Yes, I've heard of it. We don't perform it here. It does help with some bone healing, but that's the only thing I'm aware of it helping with. And we do use it for bone healing when we're doing fusions, but I don't use it for treating disc problems like this. Let's see where we are. Well, there's a lot of abnormal bone here. Okay, we're good. It's pushing me laterally, so we're going to have to see where we are. I don't know if we're able to get into the disc. We're definitely on the side of it. And we're definitely near it, so we'll see. Endoscope on.
We have another question.
I can see. Yeah, that's perfect. We're definitely inside the disc at 5-1. Go ahead. Take the question.
This next question comes from Nucleus on YouTube.
Oh, I love it. Nucleus. That's so cool.
They said, "Hello, Dr. Deuk. Do you know the story behind why Dr. Anthony Young ended up using endoscopic for spine surgery? I looked up Dr. Anthony Young in the past because of your videos."
Yeah, I believe I do, but you can share your story with us. I'd love to hear it. Dr. Young is a friend of mine. I talk to him all the time. He trained with Dr. Parvis Kambin. Dr. Kambin is the first to do the transforaminal endoscopic surgery. Dr. Kambin is or was an Iranian, from Iran, an Iranian orthopedic surgeon, and he developed the endoscopic transforaminal procedure, and Dr. Young trained with him and learned that technique from Dr. Kambin. So when I talk about who the father of endoscopic spine surgery is, it's Dr. Parvis Kambin, P-A-R-V-I-Z Kambin, K-A-M-B-I-N. And that's who trained Dr. Young. So once Dr. Anthony Young learned the technique of putting the endoscope in through the foramen from Dr. Kambin, he started to do that in his own practice in Phoenix and just started doing so many surgeries. Dr. Young told me he's done over 10,000 lumbar endoscopic surgeries. That's lumbar endoscopic. I've done 1,000. I don't know if I'll ever get to 10,000. Maybe I will someday, but that's 10 times more than I've done. He is 83 years old, Dr. Young. He is older now. He's retired. He's certainly had, 30 years on me, right? So, but that's what I know about Dr. Young's endoscopic career. It's primarily in Arizona, laser. Almost done. 5 minutes. 5 minutes. But go ahead. I don't know if there's some information you have that you want to share. I'd be happy to hear it. While we're waiting, let's take another question.
At this moment, no current questions.
Good.
Oh, Canes25 commented because of his mother.
His mother. I didn't know that. He's talking about Dr. Young's mother?
I would believe so, yes.
Fascinating. I'll have to ask him. That could be. I have not heard that story. Look at that herniation right there. This is the big one at L5-S1. It's sitting inside the tube right now. I'm going to go pull it out. It's huge. I think there's more to it. I don't have the whole herniation. This is just part of it.
Canes25 said he talked her into a fusion and she went paralyzed, and he never got over it.
I had no idea. He may have told me that, but I didn't remember it. Interesting. Oh, I see. He talked her into a fusion, but it may not have been him that did the fusion. It may not be him. I don't know. I'll have to ask him. That may be a very sensitive subject for him, too. He may not want to tell me about it, but Dr. Young is hopefully going to help me bring endoscopic spine surgery to the forefront of spine care in the United States. You may not realize it, but his work is not yet done. So I know Dr. Young's son is Chris Young. Chris is a friend of mine. We went to UC San Diego together. And Chris is an orthopedic spine surgeon, just like his father. I know Dr. Young is very proud of him. And Chris is a good guy. He does. His dad taught him, but he only does lumbar. He doesn't do cervical or thoracic. Dr. Young's never done cervical. He's never done thoracic. I'm the only one. That's because he learned lumbar, which a lot of orthopedics are okay doing lumbar. You know, orthopedic surgeons do lumbar spine surgery. He learned that from Parvis Kambin. But the cervical, that was developed by the South Koreans, Dr. Sang-Ho Lee and Dr. Gun Choi. That's who I learned it from. Dr. Young never taught me cervical. He taught me lumbar. And I learned the cervical from those guys and Sebastian Royden. And then I pioneered thoracic myself, just like Sang-Ho Lee pioneered cervical.
You got about 5 minutes.
Yeah, I said that 2 minutes ago. I don't know if you heard me. You did not?
I didn't hear you.
That's all right. I have been talking a lot. It's hard to keep track of everything I've said, huh? All right, any other questions? This is a big herniation here. We're getting rid of, just breaking it up into little pieces and getting it out. There's a bone spur right there. You guys see the bone spur turning orange?
Yes, we do.
It's really not getting anywhere near the nerve, so I'm not going to mess with it too much. I'm just going to get this mass of scar tissue and herniation out. Just about done. Sorry. Did you ask me something, Berndes?
No.
Henry, any more questions?
Yes, we have a question from, the name goes by SHS. And their question is, so did you get through or around abnormal bone?
Yeah, great question. So if you watch earlier, as I was trying to get into 5-1, I finally found a way. I had to go around the abnormal bone. And there was just like a little hole still left, you know? You know when you watch those movies like Star Wars, where they're flying the Millennium Falcon and the hole is closing like the giant worm coming out of the planet, and his mouth is closing as they're flying out of his stomach, and it go between the teeth and it snaps closed. Anyway, that's like that tiny bit of room left. That's what I had to navigate through, just like the Millennium Falcon did. So I couldn't go through the bone. The needle won't go through bone. It'll bend. It'll bend and just break, basically, bend. And so you have to really finesse it. And that's the hardest part of what I do, to be honest with you, is finessing that needle. That needle finessing technique is everything. This whole surgery depends on me getting that needle in properly. And I could tell you it's challenging. It's not easy. That's why neurosurgeons don't do the surgery. We don't do needle procedures. It's mostly pain management doctors that use a needle. 1 minute.
We have another question.
Sure.
This comes from, I'm so sorry if I mispronounced your name, Anouk.
That's a long name.
Anouk. I just hope I pronounced it right. And they're from YouTube, and they asked, why is thoracic herniation calcified so dangerous?
Oh, why? Because it's right up against your spinal cord, pushing on it, and you have to drill it or ultrasonic it, and you're basically working against the spinal cord, which means you could paralyze the patient with 1 millimeter wrong move. That's why. Most surgeons won't do it. Plus, the only way to get to that calcified herniation is to go and remove ribs and stuff out of the body. And it's very invasive surgery. Frequently you have to drop the lung, work next to the heart. So those are extremely risky types of procedures. Most spine surgeons don't think the risk is worth it. You know, they don't want to harm the patient, which is good. They don't want to harm the patient, but at the same time, if you're going paralyzed from it, then you need to have it done. So I got to be honest, though, I haven't seen too many calcified thoracic discs that need surgery. So I would recommend, if you have a thoracic disc problem, come see Deuk Spine before you commit yourself to an invasive surgery. It could hurt you. I need a grabber. This is it. We're just about done. This is 5-1 on the right side. And you could see this giant herniation here that was pushing into the nerve. I'm trying to get out as much as I can. That's another thing I like to talk about, is the herniations. People think, oh, you're getting rid of all the herniation, but we're not. Doctors, surgeons cannot get rid of 100% of the herniation. It's not possible. We are restricted with our access, our surgical access, how we get there basically. And the reality is, in the very best situation with a discectomy, you're going to get rid of maybe 90%. But the average is going to be around 50%, 60%, somewhere in there. Okay? So people think when you take a herniation out, you're taking the whole thing out. You're not. You would like to, but nobody can get the whole thing out. All right. Let's do one more grab. Just about done. That's about all I can do. That's just a wad of scar tissue at the back. And I'm debulking it, meaning I'm getting the most of it out. But probably got 60%. And that should be enough to get rid of his symptoms. All right, we are done. Lights on, we're done. Now, because of his spine anatomy, we had to do irrigation. Be prepared, guys. I had to do 2 incisions on the left side, 1 on the right. Type your questions up. I'll answer them for you. I'll come and answer them face to face. So type your questions up. But this surgery went very well. We didn't have any complications. We did have a hard time getting in on the right side. Very hard. Take this. For those of you who want to see what the scope looks like, that's what it looks like. And let's show the incisions. You guys see this here, Henry?
Yes, we do.
2 tiny incisions there, 1 tiny incision here. Great job, everyone. Thank you for your help. And type up your questions, folks. If you know somebody who does have back or neck pain, feel free to use our free MRI review. So through their website, they're going to have to put in some information and then upload their MRI images. Not just the report, but the actual images, so I can look at them. Or mail it in to our office. Those instructions are on the link. And we've got one more surgery today. It's a thoracic, single level, patient from Brazil. I'm going to call the EBL 1 mil. All right, and we'll see you guys in a few minutes. This is Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients, and you've traveled from where to the Deuk Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Deuk laser disc repair done and the Deuk plasma rhizotomy?
I had those done yesterday in the afternoon. I am sitting straighter than I have. I'm standing straighter. I'm walking normal. It's like, wow, new me.
Look at that smile right there. I hadn't seen that until just now. So
well, it wasn't there yesterday.
Yeah, it wasn't there before surgery. And how long have you been not smiling because you've been in pain? I mean, really bad pain. How long has the really bad pain been there?
Well, the really bad pain has probably been over the last 5 years. It's something that was really tough to maintain a positive attitude and try to keep a smile on my face and keep Jeff's hopes up. I tend to be a positive person, but there were times when it does drag you down.
Of course, yeah. It's hard living with chronic pain, and especially with loved ones, they have a hard time, relating. Of course, they want to be supportive, and your husband is a very supportive man, obviously. And he's a pleasure to meet. I know he's an author as well.
Yes.
And so what are you going to do now that you've had the surgery? And you could see actually the Deuk laser disc repair procedure she had done yesterday. You can see right here, we went into the discs that were damaged. You had 2 annular tears. We tested your discs during the surgery, and indeed they were causing your pain. So we verified that with our discogram. And then I went ahead and used the laser to clean up the tears that were causing your pain and get rid of that source of pain for you. And here you are, you're doing fantastic. How much of your back pain from before surgery do you still have?
Oh, virtually nothing.
It's gone.
It's gone.
Cured.
My lower back, I have not been without pain in my lower back until your surgery. It's constant, it's always there. I've never been without it. I'm without it now.
So are you going to go back to gardening?
You bet I am.
All right, very good. And what other things would you like to do now that you have a new back that doesn't hurt you anymore?
The biggest thing I want to do, I want to go fly a kite.
Good for you. Let's go fly a kite then.
That's right.
Well, congratulations on having faith and being brave
you.
and getting it done.
No, not a problem.
Is there anything else you want to say to your fans out there?
I highly recommend Dr. Deuk Spine Institute, Dr. Deuk personally, to help you fix your back.
Thank you. Appreciate that. All right. Safe travels.
Phew, that wasn't too bad, was it?
It was wonderful. And good morning, I'm Dr. Deuk. I'm here with one of my lovely patients from Canada who's visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L5-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada. who then said, yeah, I'll have you see the specialist in 3.5 years. Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years. And even then, you don't know what you're going to be offered. But she found the Deuk Spine Institute and learned about the Deuk laser disc repair endoscopic surgery. And you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be able to stand up straight and go for a walk. Because I'm an active person as is. I ride horses for a living, so having to be locked up in my room for the past while has not been good. So this has felt amazing, amazing.
So you're happy with the results?
Very. I feel very hopeful also to be able to do what I want to for the rest of my life.
Yeah, after we let the disc heal, right?
Yes, full year of nothing, and then we can.
Yeah, I wouldn't say nothing, but you know, horseback riding, it's one of those things where I love horses and I love riding horses. I'm not very good at it, but I'm one of those people you see bouncing up and down, up in the saddle. So I know that it can be rough on your back, and I just want to make sure you give your back a full year to heal. So you can see in your surgery right here, we actually tested your L5-S1 disc with a discogram, which is a test done to verify that that disc is indeed causing your back pain. And when we tested it, you said, and we asked you how bad it was, you said 10 out of 10 pain. And I said, is that your typical pain you get every day? And you said, yes, it is. So we verified the source of your pain was the L5-S1, and you can see the laser was used to clean the tear endoscopically. Your incision was only a 1/4 inch, and there's no need for fusion or metal or artificial discs. This surgery replaces fusion and artificial discs. What are you going to do now that you're feeling better?
Well, it's, again, don't worry, I will take it easy, I promise. But no, I'm going to be, after this, this year, I hope to be the strongest I've ever been, and I have very high hopes and whatnot. My dream is to make actually the Canadian Olympic team for my sport, and that's end goal, and I feel like it's a possibility now.
Absolutely.
Do it.
You can.
Yeah.
We're rooting for you.
Mm-hmm.
And I know you have an incredibly supportive husband who's been by your side the whole time. He's a delightful young man, and I've had time to talk to him as well. So you're lucky you have support from your family to help you get through this.
Yeah.
Anything you want to say to your fans out there?
Oh, geez, I don't even know where to start other than just this place really can offer you really what either you deserve or what you need going forward to be able to live a happy and good life. And it's amazing to me that literally it was yesterday I woke up from it and I went for a short walk like immediately, and I felt amazing. So it's it's very hopeful, and if there's you are suffering from any of it, don't wait, especially for the Canadian system. Come and do this. It's worth it. It's really worth it.
Awesome. And I'm going to be, and my whole team is going to be watching the equestrian sports in the Olympics, looking to see for you to be there.
Yes.
All right.
Awesome.
And
Amazing.
of course, supporting you.
Thank you. Yeah.
All right. Congratulations.
Thank you.
All right. Take care. And I'm Dr. R. Deuk here at the Deuk Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the first one of this year, of the new year. Now, you had the Deuk laser disc repair done on your lower back because you had 3 bad discs, and we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, we had company and I was opening up the bed, and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so, and then at the chiropractor, and then gradually got better, and I thought, well, that's fine. And I moved on. And then, You know, had a couple other times like that. One time I was drying my hair, getting ready for work, with the blow dryer going like this with my hair, and all of a sudden, it's like I couldn't move. I couldn't move my arm down. I couldn't, I mean, it was that quick.
Yeah.
And just, I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but I always, not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. You know, that would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is this surgery going to help you in your life?
Well, hopefully I can, once I can at least walk again. I was not able to barely walk with a walker. I was very active in my church, in my community.
So you want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, you know, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear, where you had a tear in the back of each of those discs called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith,
I
and
am.
you found.
Well, thanks for joining us. I'm Dr. Deuk Majan, and we've just completed our second very long endoscopic spine surgery of the day. Most spine surgeons that do endoscopic surgery or any type of spine surgery, they usually only will fix one disc problem at a time. At Deuk Spine, we try to fix everything. We can fix up to 6 different areas on the discs in one surgery. And why do we do that? We do it because if we were the patient, we wouldn't want to have to come back for 6 surgeries. We want to have one surgery and get it all done. So we treat the patients the same way we would treat ourselves. In other words, with tremendous respect and dignity. This patient had 4 discs that needed to be repaired. I didn't make him come back 4 separate times, charge him 4 separate times. The truth is, nobody should have to endure that. But that's what insurance companies want. They want us to do one thing at a time. They only pay for one thing at a time. That's one of the problems with insurance companies. When you let them run healthcare, is they're always going to do what's best for them, not what's best for the patient. That said, surgery was successful. We didn't have any complications. The hardest area to get into was that L5-S1. I had to go through this, and there's actually another bone right here. You can't even see it. It looks like this. It's called the iliac crest. And I had to work through this tiny little space there to get into the disc from the side. So hopefully you can appreciate that. It went well. Got everything done. I think the patient will do fantastic. The first patient's already gone. He had all of his pain is gone. He was so happy. His wife was happy. Everybody's happy. You know, it just made me think about my father, who was an OBGYN, and he told me, I said to him, Dad, what do you like about your job? What do you like about being an OB-GYN? When I was just a kid, he said, because I'm with people during the happiest time of their life, when they're having a baby, right? It's when people's happiest time of their life. And I thought, wow, that's special. But I just can't see myself dealing with that part of the body down there every day, delivering babies and dealing with that area. So I never knew what I was going to do, but I somehow made it to medicine. And now guess what? I'm delivering too. I deliver herniated discs. So what I do is not so different, and people are very happy. So actually, I followed my dad's footsteps with delivering, but a little bit different than working in the pelvic area. I'm working in the spine. All right, we'll take our questions.
This is the first question. Comes from April on Facebook. And this was a follow-up question from the previous question of why thoracic herniation calcified so dangerous. April's question is, but as long as it's not pressing on a nerve or causing pain, that's not an issue, right?
Yeah, April, you are correct. So thoracic disc herniations that are calcified or not calcified are like every other disc herniation in your body, whether it's lumbar, lower back, neck, or thoracic. If there's no pain, and there's no symptoms of nerve compression, spinal cord compression, there's no need to treat it. Leave it alone. I have a herniated disc in my back, a big one. I have a degenerated disc actually, pretty bad. And it caused me pain one time about 12 years ago. 12 years ago, I was in the pool, I had my kid on my shoulder, we were playing around, threw him off, and I had a sharp pain right around L2, L3. I thought I had cancer in my spine. I was freaking out. So it went away after about 30 minutes, the pain did, and I went and got an MRI, worried I was going to see a fracture or a tumor. No fracture, no tumor, just a herniated disc, degenerated disc. It's been there for a while, and the pain hasn't come back in, what, 12 years, 13 years? So I haven't done anything about it. You leave it alone. You know, it's not causing any nerve symptoms. It's not causing back pain, but it looks pretty bad on the MRI. And if I had pain in that area, I know exactly what needs to be done. I would just have to clone myself to do it. All right, who's next?
Last but not least, we have a question from Darren on Facebook, and they asked, how old should the MRI be?
So Darren's asking if we want to send an MRI for Dr. Deuk Major to look at and figure out what's wrong, how old should it be? Ideally, less than a year old, 12 months. But we understand how hard it is to get MRIs out there, so I have Sam here listening to me. We're flexible. I mean, as long as your symptoms haven't changed too much, let's say your MRI is a year and a half old, it's probably still okay. We'll make an exception. As long as you haven't had a massive increase in your symptoms in the last, say, 6 months. Because if your symptoms have been relatively slowly progressive for a year and a half old MRI should be fine. I don't think we're going to see anything that new. Yeah, so that's the answer.
That is it for
Thanks for joining us. Our last patient is coming up in about 30 minutes. He has thoracic pain, thoracic disc herniation. He's been had it treated at times with morphine because it hurts so bad. And actually, he's got more than one thoracic herniation. He has at least 3 of them, and we're only fixing one. We're fixing T8-9. That's the one that's causing his pain now. He has more herniations at T10-11, T11-12, but he has minimal to no symptoms there. So we're not going to fix those. He only wants to fix the one at T8-9. That's what we're doing. So we'll be back shortly for that surgery.